Hi, everyone. Thanks for joining us today. We'll hold just a minute here at the top and let folks get settled in and get their audio connected. Thanks for being here. All right. Welcome, everyone. Thanks for being here. We appreciate you joining us in the lunchtime hour, or if you're on the West Coast, in the morning. Let's go ahead and get started. So we appreciate you joining us today to learn more about our recent national poll. My name's Katie Byerly. I'm the Associate Vice President of Policy and Programs at Undue Medical Debt. And today you're going to hear from myself, Allison Sesso, our President, Eva Stahl, who's our VP of Policy and Programs, and from Mike Perry from Perry Undum, the national polling firm who we partnered with on this research. So just a few housekeeping things before we dive in. We are recording today's session, and we will be sharing out the recording as well as some additional resources via email. You can enable the closed captions for today's session. If you go down to the bottom of your Zoom toolbar, it should be there. You'll see the little CC if you'd like to see the captions for today that are auto-generated. And we really encourage folks to use both the chat and the Zoom Q&A today to join the conversation as we share these findings. So if you want to chime in, introduce yourself in the chat. We'd love to hear where you're coming from today and any questions that you have. We'll have some time for Q&A that we've held towards the end of the webinar. So fire away with all of your questions. So let's get into it. Today, we are really excited to share the results of a national poll that we did. We've heard loud and clear in these results that voters across the political spectrum want action and that state lawmakers have the opportunity to act on policies that help prevent and protect people from medical debt. So today, Allison's going to share a bit more about who Undue is if you're unfamiliar and why we did this polling research. Mike is going to share some of the key findings. Eva will take us through some policy examples and some of the policy landscape. And I'll lift up a couple of ways that we hope that you can take action as a result of these findings. And then we'll have a good amount of time for questions and discussion. So Allison, I will hand it over to you.
Thank you so much. I'm so glad to have this opportunity to tell you a little bit more about our model and to ground this conversation. You're probably asking, well, why is Undue doing this national polling? Don't they just relieve medical debt directly for people? And we do both of those things. We very much believe that our model is impactful and helpful, and we know every day from what we hear back from the people that we're helping that it's meaningful to relieve these debts. At the same time, we very much understand that the system is broken for these individuals, and we don't want to have to be relieving debts as a solution to this problem forever and ever. We know that we've learned a lot through our work, both with engaging the healthcare industry and how they think about bill collection, as well as all of the patients we've been helping and other stakeholders, that everyone knows that the system is broken and that it needs to be changed. And we want to be part of forcing that conversation forward and making sure that it's grounded in patient experiences. And so that's a big part of what we do and why we've done this national polling to help tell the story of medical debt and that it is this common ground issue. So I'll just give you a little bit of background on our model. You can go to the next slide, Katie. So we focus on people that are 400% of poverty or below, or if the debt is 5% or more of their income. That's usually the vast majority of the people whose debts we find in the files that we buy from hospitals and other healthcare providers. We never collect on a medical debt. We just let people know that those debts have been relieved. And we, really want to pair this debt relief work again with policy changes and leverage what we're learning for bigger and broader changes in the system. In terms of how it specifically works, go to the next slide, Katie. People often want to know, how does this model work? We're a unique nonprofit. We're the only ones that do this in this way. We go to healthcare providers, hospitals, and other large physician groups, ambulance groups, et cetera, as well as collection agencies who have already bought those debts from the same providers. And we have this proprietary debt engine that we actually created and built. We have a team of engineers that actually developed a software that takes those files, puts the files in, and then we buy data from a partner, FinThrive, that allows us to basically do presumptive eligibility for people. So there's no application process. We just buy those debts and then we let people know that those debts have been relieved. And how we're able to buy those debts is through the generosity of so many different sources. We have corporate supports for us. We have a lot of faith-based entities. Churches across the country have come together and bought billions of dollars in medical debt through us. Individuals of all means. I love the number of campaigns we run per year. It can be hundreds of campaigns that are run for individual communities across the country. And then government partners increasingly are looking to us to do debt relief for their communities as well. And then the fun part comes in where we actually get to send all those letters to individuals to let them know that through no action of their own, they don't have to fill out an application. There's no barrier to getting this relief. We have gotten rid of their debts. And the way our model works and why we're able to get such high return on investment, where $1 gets rid of at least $100 of medical debt, is because the system is broken, as we say. There is a for-profit market for medical debt and we are just mimicking that. And the reason why the debts are priced so low is because the individuals who owe those debts do not have the means to pay them. This is fundamentally, a flawed aspect of the way we finance healthcare. The expectations, the out-of-pocket expectations of individuals do not match their means. And so it's a very high risk business for a for-profit entity to buy medical debts and then try to follow up with people to make some collections and make a return on investment. In our model, because we're not trying to make any return on investment, we're leveraging donated dollars. We can just take advantage of that cheap pricing and turn it into relief for individuals. And that's how our model, it's not magical as sometimes people like to say, it's just math. So that's how it works. And then we've been able to, if you go to the next slide, Katie, leverage this debt relief for $22 billion of medical debt relief and counting to date, helping 14 million families in all 50 states. And we've been in existence for just a little over 10 years. So we've accomplished a lot in a relatively short period of time. The issue of medical debt, you can go to the next slide, is pervasive. We know this. It's something I think we all have wrestled with in one way or another. If it's not the issue of medical debt, it's been fighting with our insurance companies, trying to navigate the healthcare system overall. It's a very common American experience, unfortunately. Medical debt is different than other kinds of debts. Because of the fact that there is a real disconnect between what people end up in terms of the debts amounts that they owe versus their means, as I mentioned earlier. There's a lot of evidence that people, have deductible amounts that are much, much higher than what they have in savings. I think over half of Americans don't have $500 in savings, and I think that's a pretty outdated statistic, actually. And so it makes a lot of sense why people end up in medical debt. You have an expectation that they pay something that they don't have. It's more prevalent in communities of color, 50% if you're Black, 35% if you're Hispanic, like so many other things in the United States, impacting these communities more readily. It's the leading cause of bankruptcy. And ironically, it is also itself a social determinant of health. So it's actually undermining health itself. It leads to people delaying care, which obviously not only exacerbates the health event that they're dealing with, but also can be more expensive. And getting sick is the number one cause of ending up in medical debt, not your insurance rate, which is, I think, really telling in and of itself in terms of this being a systems problem. And then my last slide really just talks about how pervasive this problem is. It is, you can go to the next slide, Katie. It is hurting 100 million people, and it is at least a $220 billion problem. So it's a significant problem. It's a common problem in the United States. And as a national nonprofit that's happy to do this work to relieve these debts for individuals, we are also really leaning into strategies that help fundamentally get this problem solved in a bigger way. And that's why we've deployed this strategy, and we're excited to share with you these polling results. So thank you for being here today. We hope you'll share these results with others, and I'll turn it back over to you, Katie.
Wonderful. Thank you so much, Allison. And I'm going to keep things moving. We'll pass it over to Mike.
Thanks, Katie. Hi, everybody. I'm Mike Perry. I am with a nonpartisan research firm called Periundum. I do lots of polls and focus groups on healthcare issues. The poll results I'm going over today offer a real clear picture of how voters feel about healthcare affordability and medical debt. There's lots of agreement and unity in this poll on the problem, on who is to blame. They are having the same kind of experiences, whether they have health insurance or not. And there's lots of agreement on the actions they want to see taken. Usually in the research I do on healthcare, there's lots of agreement on people's experiences with the system, but it tends to fall apart when we get to policy. That is not the case on medical debt. It just means there's lots of opportunity for policymakers, for states to really move forward on this issue because there is so much unity around the actions people want to see taken. So with that set up, let me tell you more about the poll. Let's go to the next slide, Katie. All right, so we did 4 focus groups with voters. We wanted to hear real people talk about healthcare affordability, talk about medical debt. We had folks in our focus groups who had experience with medical debt. They told lots of personal stories around it. That brought us into a national survey. It was with 1,319 general election voters. So these are folks who voted in the 2024 elections. This is a real recent poll. We conducted this in the end of August and into September. We used NORC's nationally representative online panel to do this research. Let's go into some of the key findings. Thank you. So this is a slide I'm starting every presentation with these days, which is explaining that voters are struggling right now. There's lots of sacrificing happening. These are hard times. This is not a new condition. It's been going on for many, many years. People are getting very frustrated and are open increasingly to bigger kinds of changes and different kinds of policies. We asked voters in our poll if they'd done any of the following in the last 12 months. We got 43% who had eaten less food or bought less expensive, unhealthy food to help them meet their financial needs. We had 40% skip vacations. We had 37% put more expenses on credit cards like groceries, 24% taken on more hours at work, a second job, a side job. 21% have fallen behind in bills, 17% borrowed money from friends and family, 16% taken out an installment loan, 9% borrowed against their retirement. All told, we got 68% of voters have made at least one of these sacrifices in the last 12 months. So these are hard times. People are making lots of trade-offs in their daily life, and they're getting fed up with it. Next slide. This is a quote that was kind of indicative of what we heard in the focus groups. This was from a woman, 43. She's white. She's uninsured. She lives in rural West Virginia. She voted for Donald Trump in the last election. She said, I go to a food pantry and I work 3 jobs. You know what I mean? It's hard. It shouldn't be this hard. I don't have time to spend with my kids. I don't have time to do things because I have to work to eat, and that's what makes it hard for me. Next slide. So healthcare is only making this worse. Most people don't think healthcare is affordable right now. We got 69% of voters saying healthcare is not affordable. If you look at the partisan breakout beneath that, you get 68% of Democrats saying healthcare is not affordable right now. You get 66% of Republicans, and you get 72% of independents saying it's not affordable. So you get lots of agreement on the challenge around healthcare affordability right now. We asked if voters had struggled with any of the following healthcare costs, and we found that 45%, almost half the sample of voters, had struggled with at least one of these costs. So affording dental care, 32% have struggled with that, affording their deductibles 27%, affording any health insurance at all 20%, affording their monthly premium 19%, affording copays 19%, affording prescriptions 19% are struggling to afford those. This is not a theoretical issue. People have personal experience to draw from when we're in a focus group with them. Next slide. So they blame corporate greed for the high prices. This is sort of a moment of lots of anger towards big corporations who are involved in healthcare, the profits they're making at the expense of everyday consumers. These are 3 quotes from the focus group that clarify people's feelings around this. We had someone say, the corporations, and I think that unfortunately it's not patient care that's the important thing. It's about them making their profit. I just see like there is an uptick in corporate greed. While we're struggling, the CEOs are just filling their pockets. So these comments are kind of, come up a lot in any focus group on healthcare costs right now. Next slide. So we asked people about their experiences with medical debt and how it's impacting them. We got 35% of voters saying they have current debt due to medical or dental expenses. That's more than 1/3 of voters saying that. We got more than half of voters saying they are concerned about going into medical debt when they use medical or dental services. So anytime half of voters are interacting with the healthcare system, right there in the back of their mind is worrying about going into debt. And we know that's impacting their behaviors because that's the next finding. We found 35% of voters say they skipped medical care in the past year. They experience pain because they're putting off medical care, or they cut bills in half due to fears about medical debt. As Allison pointed out, this avoidance of healthcare has big ramifications for the health of our society. Next slide. Mental stress comes up all the time in this conversation around medical debt. We hear lots of discussion around depression and anxiety and just the black cloud that medical debt, creates around a family that's dealing with it. We asked that question in the poll. We said, what do you think is the hardest part of having medical debt? 57% said mental stress and anxiety. 50% say skipping medical care. 40% said going to doctors or hospitals where you owe debt. Lots of people are just avoiding those providers as a result, not doing follow-up visits. The monthly payments they have to make, 36% say that is the hardest part. Effects on their credit, 35% say that's the hardest part. The high interest on debt. And the calls from debt collectors, 28%, are saying that's the hardest part. We have a quote from the focus group that I feel is profound and really speaks to what we're hearing from all kinds of people about medical debt. Here's what he said. He said, medical debt on your credit report stops you from accessing jobs sometimes, homes, car loans. So much gets in the way between you and the life you want to live because of medical debt. Next slide. Voters blame health insurance companies for medical debt. This is a new question. We asked it in a different way than we have before. Normally, we give people a multiple choice. We say, who do you blame for medical debt? And they often point to many players in the healthcare system. So yes, insurance companies, but often pharmaceutical companies, hospitals, doctors get some share of blame. But when we make them make a choice, who do you blame most for medical debt? They zero in on insurance companies. There's lots of clarity here and lots of agreement that insurance companies are behind much of the problem with medical debt. You get 63% of voters saying that, and you see there's agreement across party ID that insurance companies are most to blame. I'll talk more about that in a couple minutes. Next slide. They do still trust doctors. They trust hospitals. They trust those who are caring for them, providing medical care for them. They still trust those organizations and those entities, much less trust for insurance companies, drug companies, private equity firms that own doctor practices, and corporations that run large hospital systems have much less trust. But doctors and healthcare providers and hospitals are who they still trust in the health system. Next slide. So this is sort of the meat of what we wanted to get at. They want states to pass laws that protect them from medical debt. Here's where the unity and the solidarity that we were seeing throughout the focus groups and throughout the poll, it carries through into this conversation around action. And that is what makes this issue unique. I don't see this on most other issues I work on. We got 76% of voters saying they want their state to pass laws that protect them from medical debt. If you look beneath, 91% of Democrats, 63% of Republicans, 78% of independents agree on that. 77% of voters would feel more positive about their state elected officials if they pass laws to protect them from medical debt. Again, you have agreement across party ID. And then 75% of voters would be more likely to vote for state elected officials who pass laws to protect them from medical debt. Again, lots of agreement here that they want action on the state level and that they would support any policymaker on the state level who stood up for this issue and passed policy. Next slide. So I'm going to show this slide twice in a minute. I'll show the partisan support, bipartisan support for these laws. But this slide talks about just the general level of support. There is an agreement around a variety of policies. This is not unique. I've seen lots of other polls that had a similar list. Lots of polls are sort of validating that there's lots of agreement on many of these policies that can protect consumers from medical debt. At the top of the list is limiting the interest rate for medical debt, limiting collection agencies' ability to take a person's house, belongings, or cars, requiring all hospitals to use the same user-friendly application for financial assistance, pass laws to help people understand who is suing them for medical debt. There's lots of confusion about who's calling them and who owns their debt. Set limits on how much hospitals and insurers can charge for services, limit the amount a patient would have to pay back in a year, ban collection agencies from taking money out of people's paychecks, ban reporting medical debt on credit reports. 81% support that. Create a state-funded health plan that may be more affordable than other commercial plans. 81% support that. Require hospitals to provide financial assistance to patients earning less than 200% of federal poverty level. Stop prior authorization for some services, require hospitals to screen everyone for financial assistance, and raise the income threshold for Medicaid so more people can qualify for insurance. So I think the reason, when we discuss these policy ideas and people in our focus groups get to reflect on them, they seem really pragmatic. They seem doable. They seem like states could do those right away. And I think that's the appeal. The more ideological, bigger picture, reform or change we talk about, that's where some of the conflict comes in, but not on these kinds of policies. Let's go to the next slide. This shows you the bipartisan support. Again, you don't see that on most issues these days, most of the issues I work on, but you see across the board, there is bipartisan support. Even on more, what you might consider more controversial issues like raising thresholds for Medicaid, for example, you still get 63% of Republicans supporting that idea. So there's lots of support for policy change on this issue. Next slide. They see these as common ground policies. So common ground is something I'm noticing that voters are out of practice in finding that. We've been divided so long. We're being a picture of us as being pushed back on us, that we are a divided country and we can't get along, we can't agree. But we saw in the focus groups that people could find their way there and they could see there's lots of agreement on this issue. When we asked about it in the poll, we said, do you think people from different political parties want these kinds of protections for medical debt? You get 57% saying yes, 42% saying no. And then you see across, these aren't huge majorities, but the fact that they could find it in this environment is telling to me. You can't get this kind of result on any other issue I work on right now. And here's a comment from one of the focus group participants. He said, I think this is an issue that's a common ground issue between Democrats and Republicans when it comes to health insurance companies and just the cost. It doesn't matter, what your political ideology. I feel like everybody's frustrated with the system and everybody wants it to be better and everybody wants costs to be lower. Next slide. We've been finding this in lots of our polling right now. There is a feeling that the health insurance industry is failing. It's supposed to protect us from medical debt, but it's not. And it's causing lots of frustration with health insurance companies. And that is why earlier on, we had that finding that people blame health insurance companies for medical debt because it is supposed to protect us. That's what we're paying it to do. We found 84% of voters agree health insurance is supposed to protect people from medical debt. You've got agreement across party ID. You got 74% of voters think health insurance is mostly failing in protecting people from medical debt. Again, there's agreement here across party. 66% of voters are not satisfied with the current insurance system. Again, there is majorities across party ID. So there's this kind of mandate for change, support for change, particularly when it comes to the health insurance industry. So let's go to the next slide. This is what this finding is all about. We got 76% agreeing with this statement. It says we need to switch to a different system of health insurance where people can change jobs or become self-employed and not have to worry about losing their health insurance. Versus we only got 22% of voters saying they agree with this point of view, which is our current system where most people get their health insurance through a job works well enough and we should not change it. So change is in the air for lots of voters. They really want to see something different, more options, more choice. Next slide. But they don't think high deductible health plans are really the solution. It was remarkable how quickly people sort of see through them and how wary they are of them. We got 70% of voters saying they have an unfavorable view of high deductible health plans. Again, that's across party ID. We got 70% of voters saying they would be unlikely to enroll either themselves or family members in a high deductible plan. Again, there's agreement here across party ID. This quote sort of makes their feelings clear. She said, I think high deductible plans may actually backfire because people are going to want to pay the lower premiums, but then when they need to seek health care, they're not going to do it because they know that they can't afford the cost out of pocket. With that, I will stop and I will pass it back to Katie.
Thanks so much, Mike. We're going to dig into some of these policy solutions, and I will pass it over to Eva.
Thanks, Katie. Thanks, Mike. Next slide. So Mike did a nice overview of the list of policy options, and we should say that we're just going to dive a little bit deeper into some of the top rated policy options that voters had to choose from. And just to know that we're just going to sort of touch the surface on these today, but that we plan on releasing a set of briefs that will sort of tackle these one by one to dive a little bit deeper. But this should give you just a sense of both where this is happening across the country, but see more closely what the numbers look like in support of these different options. And then I would also say that following what Mike highlighted around people interested in something different, particularly around the insurance space. We tested fewer of those options, but we'll talk a little bit more about how the entry point of medical debt and state actors being able to do something right now really is an opportunity to build trust and create a foundation for more long-term solutions. So the number one policy issue that voters really supported, 94% of voters really supported limiting interest rates charged for medical debt. And I think this really speaks to how people see medical debt perhaps a little bit differently and really see it as a debt of it's not a debt of choice, right? It's a debt of necessity. Putting consumers or patients really have very few choices but to take on this debt. And so if you look across party lines, you can see on the boxes on your left that there's strong support across Democrats, Republicans, and independents for capping interest rates. And Colorado offers a good example that's done this, where they limit interest rates to 3% and ban it for people eligible for financial assistance. And then even North Dakota limits interest to 1% so that people aren't paying more than $25 a month for hospital bills. Next slide. Another area where there was very strong agreement is around protecting personal property. So 90% of voters support policies that limit collection agencies' ability to take people's homes, their belongings, cars because of medical debt. These are actually broader consumer protection examples in Florida, Texas, and Arizona, so they're not actually limited to medical debt. But when framed and asked patients about their feelings about this, particularly as it relates to medical debt, you see really strong agreement that despite party affiliation, people feel really strongly about this, and particularly protection of primary homes. And Arizona, as people might recall, was a ballot measure that included multiple forms of debt, but also some specific protections around medical debt as well. Next slide. A third and interesting response from voters was the need for simplicity. So uniform financial assistance applications was really popular with voters. So 89% of voters support policies that require hospitals to use the same user-friendly application for financial assistance, otherwise known as charity care. And actually only Maryland and New York require a uniform application. But there are other states that set guardrails around what questions can be asked on those applications, or even in Ohio where they provide a sample application that makes it simpler. I think this really speaks to the need to make this a simple process for patients, that that's what they're seeking. They begin such a confusing time and often under duress. What's the fast and most efficient way to help them get to the right outcome? And for many people, this is financial assistance offered by hospitals. There's pretty strong agreement across party affiliation for this as well, and multiple ways to think about and implement it. Next slide. Lawsuit transparency was another one. As Mike noted, people are often confused about why they're being taken to court and who they owe money to. So 89% of voters support laws to help people understand who is suing them. Sometimes this is not clear when they show up in court, and many people actually end up in what we call default judgment because they don't show up in court and lack a true understanding of why they're being sued and what for. So Indiana has strong documentation laws that apply to all debt collection cases, while Colorado and Oklahoma require some additional documentation in medical debt lawsuits. And we will also, following this webinar as well, provide a fact sheet with some additional resources from some partners across the country that really dig deep into this issue. With respect to lawsuit transparency, that would be Pew Charitable Trust and National Consumer Law Center. But you can see actually the sort of broad set of support across party affiliation when it comes to medical debt and lawsuit transparency. Next slide. And then finally, credit reporting bans continues to be something voters want, right? So 81% of voters support these policies that would ban healthcare providers and collection agencies from reporting medical debt on their credit reports. As many of you know on this call, the Consumer Financial Protection Bureau has refuted the ability of states to be able to ban medical debt from credit reports. And yesterday, the ACA International, a debt collector association, filed lawsuit in Colorado challenging Colorado's ability to do this. So the jury is still out, but I think the important message here is that voters themselves want this, and there's strong support across Democrats, Republicans, and independents. And you can see what states on the map on the right, and there'll be a link and follow-up resources to dig a little bit deeper into where these credit reporting bans currently exist. And we still continue to think that there's opportunity for states to take this action. Next slide. So really, that's just a snapshot of some of the policies that are of interest to voters across the menu of options that they were provided. And I would encourage you to dig a little deeper into the polling and the slides that we provide, because you can see all of the different policies that are of interest, but they all really tend to have a lot of support. And I think that's really important and speaks to the energy and interest in states picking up this issue at a state level when there's strong distrust and discontent with the federal government. So despite the severe cut in resources to states, I think there's a glimmer of light and opportunity for states to take action and really begin to build some bipartisan trust on healthcare in their state. And looking forward, I think that that opportunity really in building that trust will create a foundation for longer term systemic change that's really needed for a broken healthcare system. And I will hand it over to Katie.
Thanks so much, Eva. So before we dig into questions and some time for discussion, I want to highlight some of the ways that we hope that you all can use these findings. So first and foremost, we hope that you will use these findings to educate state policymakers. Many of you connect with your local state policymakers. and some of you have access on a national level. But as we've mentioned, affordability is a huge issue right now, and policies to prevent and protect patients from medical debt offer a bipartisan solution that are aligned with making healthcare more affordable. So, we hope that you'll use the resources that we share after the call to understand what your state landscape looks like, highlight this affordability issue. And as Eva mentioned, we're going to be releasing policy briefs, digging deeper into examples for each of these key policies in the coming months. So we hope you'll stay tuned for those. We also really encourage folks to engage community around these findings. We hope they can spur community conversations around medical debt. As we heard, the stress and mental toll from medical debt is really a top concern, and sharing stories in community is one way to help reduce stigma on this issue. Elevating people's personal experiences, letting them know they're not alone in this issue, helping them navigate the resources, and when the time is ripe, helping them really educate and move forward around policy changes. And our findings also show that voters do trust their clinicians and hospitals on providing issues on this issue. And so inviting providers to the table to also be part of these solutions could be a really powerful avenue. And finally, we hope that you simply share these findings, right? We hope you can use them in your work. We hope that they are useful. We encourage you to let us know what additional resources would be helpful for you, and to stay connected. We'll share the link to sign up for our newsletter in the chat if you aren't already following us there. We send out a quarterly policy newsletter, so not too high on the email burden. But that's a way that we'll be staying in touch as we share these policy findings, and as we continue to work on briefs. So we have time for questions and answers. We hope we'll use the Q&A function. Also, if you're able to, you can raise your hand and we can unmute you, but we'd love to hear what questions are coming up, or comments on ways that this is resonating in work that you might be doing as well. So I will open it up, give folks a second to type in any questions they might be sitting with. And I'll invite our presenters. I'm going to stop sharing the slide here, and I'll invite our presenters to hop back on camera as well. Okay, so a question coming in, I'd love to hear folks' thoughts on. Folks are noticing a lot of polling going on right now, out in space, and curious, kind of what is exciting to you about this polling data specifically, and how people might be able to use it?
Well, Mike is the one who's the expert on this and all the different polling, but I'll just say I'm excited about it. And we did think a lot about, how is our polling different, and wanted to make sure we were being additive and not just repeating the same things. From my perspective, the fact that we focused on what states can do, some tangible actions, I think is a little bit unique here. I really also think that the findings around high deductible health plans, specifically sort of zeroing in on that finding, as well as that people really do want to see insurance sort of broken from employment, I think is also unique in my estimation. But I think Mike should weigh in.
I liked your answers, Allison, honestly. So I guess we were talking before we started this webinar, like, are we at a tipping point on affordability? Is this gonna pick up momentum? So in as much as our polling is continuing to add pressure for policymakers and media and others to keep on a conversation around affordability, I think that's a good thing. I also think it's a good thing that the polls are showing the same kind of thing around healthcare not being affordable, that people are having the same kind of experiences, whether you have insurance or not. So this is one unique aspect about medical debt. It's not, oh, it's a problem for them, but not a problem for me. It's a thing that unifies all of us because we all feel at risk. That also makes this a place of unity and a special kind of issue. And then all the agreement on policy, which again is not so common these days. I mean, I do lots of polling. I have a poll in the field every week, and I don't see this kind of agreement on most of the things that I'm working on. So it breaks down on policy, but this does not break down on policy. So to me, this is a winning space for any policymaker. I would be jumping on this if I was a lawmaker and wanted to move forward and address affordability. This is the blueprint to do that, and there's lots of support on it. So I think the multiple polls are a good thing, and I think they're raising this issue up, and I think they're putting pressure on the system to consider these ideas. And yeah, I think it's a positive.
Yeah, I just want to add on to that too. One thing I think we didn't highlight here that was because we obviously picked and chose which things to highlight. We actually asked a specific question about if you would view your local elected official more positively if they did make this a priority and voted and put these bills forward. And the answer was resoundingly yes. So I think that's a really big takeaway for policymakers to see that voters would actually see them in positive light if they took up this issue.
Yeah. Thanks, you all. Okay, another question. Somebody curious in the finding around corporate greed that we lifted up, right? So they said, noting that many believe corporate greed is to blame for high prices. And is there a concrete idea of the types of corporation folks are referring to, or does it seem to be more abstract? So I know that was something we heard in the focus groups. But yeah, curious if you all can share more about specifics around types of corporation folks might have been referring to.
Yeah, I mean, I think it's hard to know exactly, right? We can't, I don't know that we can 100% pinpoint the answer and you should be like, they said this, it must be this, right? But I got the sense that it's the profit making that's happening in healthcare in general, right? There's a lot of money that's being made in the area of healthcare. And there's a lot of private equity buying up of hospitals. There's insurance companies have, very high margins of profit. I think there's a lot of companies, frankly, that are also, helping with hospitals with revenue cycle solutions that are aimed at getting people to get on payment plans or figure out how to get them to pay, et cetera. And I think people see that, and that seems like wasteful in terms of our healthcare. So I think that's and really problematic. I mean, money in healthcare should be going for the care services, et cetera, and doesn't seem to be where it's going. So that would be my answer.
Yeah, I think I agree with you, Allison. And I don't think this is like a random thing that people are just throwing out there. I think they are noticing all the mergers happening in healthcare. They're seeing the health systems and their local hospital getting rebranded under like a big corporate name. We're hearing comments like, okay, like the physical structure of hospitals and the grounds are beautiful, but like what hasn't changed is patient care, so they feel like this is just, as Allison said, money, money, money in healthcare, and they are seeing this like in real time. They're seeing it in their own communities, and so I think that they are kind of pulling these images in their minds when they're talking about corporate greed. Yes, it's a private equity firms, but it's these big mergers, it's these big, big systems. It didn't used to be this way. It's changing. They're seeing it. Names are changing in their local communities. So yeah, they're actually seeing it in real time happening.
Thanks, you all. Another question that asks kind of is there a change from past polling? So somebody lifting up, I'm a little surprised to the extent to which respondents blame insurance companies since it's providers that are usually actually billing a patient, right? That's often the name on the bill. And here, the person's curious, is that a change from prior polls? I'm not sure if we know that or not, but Mike,
Yeah,
kind
I'm
of
not
looking to
sure if
you,
it's
have we asked that before?
yeah, I'm not as sure if it's a change from prior polls. I couldn't answer that question. I will say I'm not terribly surprised. I think there's a lot of frustration with insurance companies. We hear this from people we help all the time that there's a just a lot of loopholes that they have to go through in order to get the coverage that they need. They also feel like when they go to use the insurance that they thought that they had, there's a lot of out of pocket that they have to pay before the insurance pays a dollar. And I think that in general is a change. So I could see that. And yes, hospitals are responsible for billing. And so there is, I think people understand that, but I also think they're the ones that are responsible for giving the care that they needed when they most needed it, right? So people have a lot of appreciation for the care that they're getting, and for the fact that the hospital was there when they needed them to be there. The same can't be said for the insurance company, who is just really the payer at the end of the day, right? They're not the one that's sitting at your bedside helping you get through the moment that you need to get through, and giving you the surgery and the treatments, et cetera. So I think that's an element of it. I will also say I think hospitals, and I think it's because of advocates and a lot of focus on this, that have been leaning into their financial assistance policies and trying to get more information out there. I don't think that they did that. Again, I think that there's a fair amount of reaction to pressure on that, but nonetheless, I think that there is a robust financial assistance policies in place for a lot of hospitals. Maybe not enough, that's for sure. I could say there's always more work to be done, but I do think people do understand that the hospitals are, in some respects, trying to come to the table.
That's great, Allison. I think someone made that comment about all the polling happening right now. The benefit of all the polling is we're getting better at asking questions and getting underneath people's feelings around this really complicated issue. And one of the things that we did new this time was made them choose one of these entities who they most blame. And that is where insurance companies. So it was a new question, but I think that feeling was already there. It just, we asked the question differently and we got that finding. And I think the reason is what Allison said, is they have positive views about hospitals and providers. So that is mixed in with their feelings around medical debt, sort of make it more complex for them, but not so insurance companies. And last thing I'll say is I think they're looking sort of further up the pipeline, and they are seeing the failure is that insurance companies aren't protecting them from the debt in the first place, and that they should be protected from it. And so I think that's partly also why they're looking at insurance companies, because they look upstream. And if insurance companies were doing what I'm paying them to do, then I wouldn't be dealing with this debt.
Yeah, thank you all. Okay, a question, Keen, specifically around dental debt. So somebody asking, they've been learning more about how dental debt fits into some of these broader conversations around medical debt and potential solutions, right? And we saw that, I think it was the question about what people haven't been able to pay, feel they haven't been able to pay for, right? And dental care, it was at the very top of that. So wondering how we think that dental policy advocates might be able to use some of this data, or generally better engage in the conversation around affordability. Eva?
Yeah. So I would say yes, dental debt is a huge driver of medical debt. So thank you for raising that. And I think there is an opportunity in that, particularly when you think about what was the #1 rated policy, is limits on interest rates, right? So I think there is an increased focus and light on these payment products and credit cards and how people are paying for these unpaid medical bills. And dental is really front and center, particularly when we look back at some of, I think the National Consumer Law Center did a survey around credit cards. And one thing that comes up is dental over and over again, right? As well as veterinary debt, actually, which falls under medical debt, which is something people raised up. And we did our own polling of our own, we did a survey of our own constituents, actually, around this issue of credit cards, and dental comes up again and again. So I do think that there's an intersection between where we're going to see increased focus for policymaking at the state level around some of these payment products, and that's a great opportunity for dental to work hand in hand with affordability advocates on this issue, because it is such a huge driver of medical debt for folks.
Thanks, Eva. Any other, Mike or Allison, other thoughts on that point around dental that you want to add on? Wonderful. Yeah, it's I was actually on a webinar yesterday where folks were talking about bans on credit interest rates generally, right? And thinking about how medical, it was also a popular, they had done polling, also a popular issue, right? And medical debt definitely can be a voice in that as well. Um, okay, another question here that is coming up. This person is kind of curious, right? People are pointing to insurers as a key driver of the medical debt problem. Curiosity around how the field can do better messaging on what is driving the problem of medical debt. If people have a feeling that it's insurance companies, is that the case? And how can the field maybe contribute to messaging around what some of those drivers, public education on the drivers of medical debt?
I think the problem is that there's a lot of drivers of medical debt. It's not like one thing. And I think the system of healthcare financing and access and insurance is extremely complicated and has gotten more complicated as we keep coming up with solutions that just plug holes and don't fundamentally get to the root of the problem. So I don't know. So I think it's a hard question to answer. I struggle with this. I think that it is multiple things. Affordability. I mean, that's, that's, and how much of it is focused on what the patient has to pay out of pocket. I mean, we've sort of made some real choices here to focus on medical debt, and that means like what's falling in the patient's lap. To me, the issue of medical debt and patients' struggles is it's this tug of war that goes on between the hospitals and the insurance or the healthcare providers and the insurance companies that leaves the patient in the middle. And if you look at the solutions, for example, that we put forward that people are getting behind, it's really they're primarily aimed at just taking the patient out of the equation, and that's I think where we think that there's common ground and that we can actually do something here. In terms of messaging around what specifically is the cause, I mean, I think that's a debate we have to have about it being one thing versus a confluence of things that together create medical debt. It's high prices, it's under insurance, it's insurance premiums, it's people, not enough people getting insured. I mean, and one thing's for sure is that we're going in the wrong direction on this problem with lots of cuts to healthcare overall. But maybe that creates an opportunity for a larger conversation. You sort of like breaking it. And so what does that mean in terms of what we do going forward? I think it's going to be probably pretty painful. But I feel like we may need to lean into that and think about, does that open up the conversation to bolder solutions for us? So I don't have a perfect answer around that question. I think it's a hard one, but I'd be interested to hear what Eva and Mike have to say.
I would just say that affordability is on the menu, right? I mean, I think that if we know anything from this week, that it's top of mind for voters, and it's really important to them. We had this conversation earlier. Is it a tipping point? I don't know, but it certainly is a cracking the window open and making sure that healthcare is working, I think, alongside other affordability issues for families right now. As you saw from the polling, this is, people are really struggling with everything from food to healthcare access. So I think that it's important that healthcare sort of stay a part of the conversation and work in coordination with those other efforts.
Yeah, thanks you all. Yeah, so looking at, and to clarify in the question, I'm not sure the person was asking for the cause, right? But really, what I'm hearing from you all too is how do we paint this clearer picture of the issue while we're lifting up some of these common sense solutions that do have bipartisan support that we can move. That's great.
Yeah, and I'll just add one other thing. I think the issue of medical debt to me is it's affordability, meaning like it's not just the healthcare financing system, like that's broken, right? But then so is our economic system. People are struggling in general, and then we're asking them to have to pay a lot out of pocket for access to the healthcare system. So it's those two things that are both broken that are really leading to this issue of medical debt. So people are coming to the table with not a lot in hand to begin with, and where those numbers are getting worse, as well as the system is requiring more and more out of pocket at the same time.
Yeah, that's a great point. Well, we are coming to close on our time here, and just a comment that somebody left, I think is sort of a great way to round out. They mentioned something else to consider thinking about the high cost of healthcare. Is we have a sick care model, right? People seek treatment when they know something is wrong, and often that means that they're going to intersect with a higher cost. And we know medical debt from our findings, right, is something that is causing folks to delay care even further. This person mentioned how we can be talking about the proactive approach to healthcare and education, really thinking about wellness. I think that this is something that we've been talking a lot about. It's how do we shift towards that? How do we build that new for the future? And in the meantime, right now, what are actions that policymakers might be able to take? And I'm excited about the poll that we've released for those reasons. So as we close out, I would love to turn to our speakers. Any final thoughts? Eva, could we start with you on a final thought you might lift up in closing?
Yeah, I think it's an exciting moment for those that are engaged in state level work. And I know I was actually in North Carolina yesterday that's done a lot of work on medical debt and trying to think upstream about policy changes. And I think there's just, their sense is that despite all of the federal cuts and the pressure that they're feeling within their own state budget, there's still a lot of energy in innovation and particularly on this issue of medical debt. So I hope that that people walk away feeling a little bit hopeful that there's good work to be done, and we look forward to continuing to engage.
Mike, let's go to you next.
Building off what Eva said, this is a place of hope for me, which I really want to feel right now, and that, something can be done and we can move forward, and this is a place for it. And so I just feel there's lots of opportunity. I want to keep doing more polling on this to keep putting pressure forward about that there is a way forward on this issue. So I think that is, to me, the thing that stands out to me is all the potential here. It's a winning issue no matter who you are, and we can really actually do things that improve people's lives right away. That's my takeaway.
That's wonderful. Allison?
Yeah, I would just say I echo what everyone has said already. To me, it's really exciting that we have a common ground issue. I think we really need one in this moment. We need a sense of change that's actually doable and you can wrap your hands around. I think I just want to also thank everyone that's here today and all the work that they're doing to pay attention and lift up this issue. It's not undue by ourselves that are going to be solving this, obviously, by any stretch. And I want to just make sure that I put out my appreciation for everyone that is focusing on this issue and having this debate and discussion. I wouldn't get out of bed in the morning if I didn't think that some change was feasible. Some is going to be in the short term, but we're also laying the ground for long-term change, I think, and we're doing that together. And I just want to tell everyone how much I appreciate our collective efforts together working to get something better as patients absolutely need it. What we have now is just untenable. I think we all know it, and I'm looking forward to seeing some movement on this issue. And thank you, Katie, for doing a great job here today.
Thank you all so much. Well, I just dropped 2 links into the chat as some final thoughts. Both the link to sign up for our policy newsletter so we can stay connected on this issue, and then also the link where you can find the full report with all the findings. And stay tuned. If you registered for this webinar, you'll be getting an email likely on Monday with the recording, as well as a fact sheet that we'll be releasing that digs a little bit deeper into some of the policy findings. So just echoing what Allison said, thank you all so much for joining us today. We really appreciate your interest in the topic, and we hope to stay in touch and continue to work together on creating solutions around medical debt. Thanks you all. Have a great rest of your day.